I think we're all hoping that, the world and Northwell does not experience this pandemic-like circumstance again. However, permanent changes are how we do run things operationally. So we have taken a very much ICS structured report, an incident command system, which is kind of pulled from emergency responses in military, and now we have systems set up that is kind of like a dial. So when we need to dial up, such as load balancing and pandemic, we dial up. When we need to dial back down to normal operations, we dial back down. If the hospital happens to have an evacuation for fire, flooding, etc., we just dial back up. So, thanks to COVID, the silver lining is now we know how to move this seamlessly from a high incident to a low incident on a daily basis.
Is he clammy or having cold sweats?
Hey, Max,
does he have a history of heart problems?
I have a...
So at Northwell Health, we have 23 hospitals, we have 76,000 employees, over 700 ambulatory clinics. It's an enormous healthcare system, and we leverage that in the pandemic for patient movement significantly. In the first wave, at about March 18th, we were having discussions that we might need to start thinking about moving patients because some hospitals, specifically Forest Hills and Valley Stream, were seeing a huge influx of patients, exponentially increasing every day. And so what ended up happening is by March 21st, before we even had really a chance to build a process, the decision was made, let's just start doing it. What we managed to do in the first wave is that we found a way to have our patients, to have the patients who needed to be transferred, needed to be moved out. We essentially made a list on a cloud-based shared list that the receiving hospitals would actually look at that list and they would choose the patients that they would take. So what we found was it's very hard. We had what we call the matching problem. We had to match the patients who need to be moved with one of our 23 hospitals. That's really hard. So you want to move 40 patients, each one has to be matched. So we got around that by opening that up to and making what's called the matching marketplace, which is crowdsourcing, where we would have the member hospitals would look at the list and be able to choose which patients.
Okay, so they're going to India.
This is a matching market concept, and it was very effective. We went from barely being able to move 5 or 10 patients a day to moving 70 patients in a day within a week, because this was so much more effective as a process. And that was able to decompress those hospitals that were under extreme duress.
CPR scramble. Just a good I'm sending the paramedic right now.
Thanks,
Frank, what was your heart rate?
Are we in your way?
For the second wave, we decided this model isn't the ideal model. The best model is to be proactive. Let's move 5 to 10 patients a day and prevent from getting to the point where we have to move 30 or 40 patients. So we built a whole new model. We actually built software specifically for this, just to help us do this, to make sure that we can match patients in a kind of a much more precise surgical manner and move those patients and prevent having to get to a point where we have to move 40 to 50 patients a day.
Code 3. I'm gonna have you back on 6014 on their assignment. They're currently on the Elizabeth Parkway West by exit 20 S as in Sam.